My name is Delilah. My full name is Delilah Matakova. So I have acquired a bachelor degree in health science, in psychology in particular, also in humanities and social sciences. And then I pursued my Master of Science in HRM, in particular with a focus on also organizational psychology. So currently I'm working at Capital College. I'm a program manager. And we are actually conducting our virtual counseling on a daily basis. So we thought it would be a great idea to share with you guys the core principles of counseling and what are the ingredients, characteristics, what are the main approaches. And in case if you, after this webinar, you would require any in-depth more details, because this one will cover only core principles. In case if you require something more, you can always email us, contact us, and we'll try to assist you and help you. Okay? Okay, so let's start. So the first, let's talk about the current situation. Why, in the first place, you joined this webinar is because we are caught in the middle of pandemic right now. So we're stuck at home, we're quarantined, and we're actually understand that technology and virtual world has invaded our life right now. We're doing everything online. So we're studying online, we are managing our finances online, we are like pursuing our education, learning new skills. We are actually literally we are maintaining our relationship online right now. We're talking to our families, our friends, and we're even shopping online. Of course, it was common even before COVID-19, but right now we have no choice but to do that only virtually. So the counseling is not an exception right now, especially in educational field. We feel that it's a very important topic to cover, how to conduct these counseling sessions online virtually and still use the techniques and approaches to make the students feel more comfortable. And not to forget that, of course, we are all in this together, we understand that, but the most important as counselors and as an educational specialist who work in this field, it's very important to make sure that students they feel safe and they feel secure. So what are frequently terms can be used? We can call them also surrogates terms. We can call virtual counseling cyber counseling. We can tell them online support. Very frequently, we can see even online ads, they're using web therapies as well, web-based counseling as well. So if we're talking about counseling, what is the main definition? So basically here, guys, you can read the official definitions of the counseling, but if to speak in more simple words, we just have to say that counseling is a process between counselor and counselee, where counselor is assisting counselee in providing the services where the individual can use to make decisions or to learn more about himself or herself, and to make the right choice, to plan or to adjust to some new environment or whatsoever he or she is facing. Yeah. So these are the main and general definition of counseling. But today we'll not only cover counseling, we'll also talk about guidance. Why? Because a lot of people mistakenly think that counseling is either the same term as guidance, so we can actually use them both, or at the same time they feel like there is a difference, but they don't understand it. What exactly is the difference between them two? So I thought it would be great just to start off with these definitions and just to talk about also the difference between counseling and guidance, not to mistake in those two. And please let me know if I speak too fast. I will slow down, okay? Because I have this habit of talking very fast. So what is the definition of guidance? We can see here that guidance is also an assistance. It's also a continuous process, basically where we are providing an advice. We are guiding, we're directing. And but we're doing it only through his or her own efforts to discover and develop their potential and their skills to understand the situation, to cope with it, to find the right decision, and to implement this in the real life. Okay, so it sounds very familiar, right? Like both of them are process, we're helping people. So what is actually the difference between those two? So here, they are actually related. They are very much related, but the difference is that the guidance is the big umbrella. Okay, it's more general. Uh, okay, it's more general concept, and counseling is actually a part of this guidance. Okay, so it falls under this umbrella. And guidance we mainly use in educational contexts. Why? Because with students, we are usually what? We're indicating their problems, their bad habits, their behavior. We're pointing out at it. We are showing them the way how to cope with it. We're leading them. And most importantly, we're directing them. Whereas counseling is more, we will cover that in more details right now in a second. Counseling is a more specialized service, okay, of guidance. So we will cover it right now, where I will talk about the counseling, mainly focusing on emotional side of the individual, of the counselee, whereas guidance more focused on intellectual side. Yeah. But when we're talking about the counseling, it is the process of helping the individual or individuals learn more about themselves, their present, their future, their goals, the situation they're in right now, and actually work through their emotional blockage, basically. So here we can see the table, okay? I just briefly put it in here, the main points, what is the difference between them. So we already talked about that the guidance is a broader term, it's more comprehensive, while counseling is more in-depth and it's more narrow and it's more specialized here. So guidance, as I talked just now, it's more external. It helps people to understand the situation. It helps to teach them how to find the solution for their problem. Okay, whereas counseling is more focused on changing individuals' perspective on the situation. Okay, so in that case, we are actually just shaping their idea about the situation. We're helping them to actually get through their hardships, through their emotions, through their feelings, and finally find themselves in the right position where they are capable of making their own decisions from onwards. So here we can see also that the guidance is mainly preventative and is developmental. Whereas counseling, it's more remedial. We can call them curative as well, and it also can be preventative as well, and it's developmental. The next, we can see that again, I already mentioned that before, that the guidance is or uses more intellectual attitude. They are emphasizing intellectual side of the individual, so they are not going in depth. That's the reason guidance has its own limits. Also, I think it's worth mentioning why they have limits is because a guide, we can all guide, okay, anyone. We can literally advise anyone, our family member, be it a colleague, be it a student, doesn't matter. But if, for example, personally, I'm not a specially trained professional in this field, I can only use guidance. But counseling usually requires more more trained skills here, and that's the reason, like we will talk in the end, what are the main requirements for the counselors. And usually it would be a bachelor degree in psychology, it can be in social sciences as well, but the person has to understand how to work through the process itself and how to tackle the issues through the specific techniques and approaches. Okay, we basically call it therapy. So here also the next one, we can see that the guidance is a decision making is operable at an intellectual level in guidance, whereas counseling operates on emotional level. Okay, guidance is generally education and career related. It may also be for personal problems, but to some extent, as I already mentioned, yeah, not to harm anyone. If you are not qualified to give counseling, you are not doing that. You are just guiding them and advising. If the matter is critical, you're referring a person to the professional who can provide those services. Counseling is mostly offered for personal and social issues. So I think so far we're good. So what are the main purposes of guidance and counseling? They are the same actually, guys. You can see here, I didn't separate those. They are literally the same. We are providing those services for those who need help, support. We're providing information. We're providing assistance. So we're also helping people to make a wise choice in their lives, to understand themselves, to maybe adjust to new environment, or to adapt to the current situation they are in right now. For example, this is very relevant right now. We are in the middle of pandemic. People are worried, people are scared, people are insecure, they live in uncertainty right now. So I think this is the crucial time to provide such services where at least they can get this mental and emotional support through through virtual right now counseling or guidance. We are also providing those guidance and counseling, those services for the purpose of making individuals be more independent, to efficiently use their capabilities, their skills, to understand what skills they have in the first place. Because usually, guys, students themselves, even I'm talking in terms of education right now, students themselves, they're not even aware what they possess, what skills they have. And we will talk about the tools that we can use in order to identify those. We can also talk about, in general, actually all these purposes. If we sum up them together and put in one word, they're all aimed at personal, spiritual, physical, psychological, social, emotional growth in order to build more productive and happy life. Okay? Okay. So here right now, what are the main characteristics of the guidance? As I already mentioned, it is a process. It is a continuous process. It's a series of actually meetings and sessions that we have between individual and yourself. We are trying to here direct and help them to develop. Meanwhile, we are getting involved or engaging in the guidance services or in this process as it is. The guidance actually, it's meant for all, any age, any occupation, any personality whatsoever it can be. It can also be generalized and it can be specialized service. So for example, it can be generalized in terms of if a person asks you, what shall I do with my life? Yeah, what do you think? What can I do next? And then you start from a general question, what do you like? Where do you see yourself? Or it can be more specialized in terms of if a person or a student in our case will come and ask, for example, which program shall I use? Yeah. In Capital, we provide a vast majority of different programs, different levels. So people, they feel confused usually and perplexed, like, oh, for which one shall I choose right now? And in that case, we also provide the counseling sessions for them, where we're trying to identify, like, what are your weaknesses, what are your strengths, where do you see yourself? Because, for example, let's say about MBAs, there are different types of MBAs. So in case which MBA you'll opt on will decide actually what career you will have in the future. Okay. Guidance is an organized service and it's not an incidental activity of the school. This is the general characteristic, but it happens especially in schools right now, and also in our college it happens as well, where randomly student will just come and start asking for advice. In that case, of course, we recommend to provide like a short information or brief information regarding the topic, and then we set a specific date and time where we sit together calmly and we discuss, and then we actually trying to identify whether a person needs to go for further guidance, so we are arranging the next meeting, or it will be enough just to finish within an hour or two. So here, as I mentioned before, you can see And in this point, guidance has limits. Okay, guidance does has limits, and I already told you why. If you are not eligible to provide a specialized service of counseling, you are not a trained counselor, it's advised not to do so. Guidance is more an art than a science, and guidance has, sorry for the misspell, its roots in the educational system. Both guidance and counseling, they are centered around the needs and aspiration of students. If we talk about a characteristic of counseling, it's more detailed here. You can see, because counseling, as I already spoke, it's more specialized service. It's interaction between two individuals. There should be counselor, there should be counselee, and the main thing is that let's say the most important thing in counseling is to build relationship between counselor and counselee. It actually will predetermine how the session will go and how effective they will be, and we will also talk about that in a few minutes. So counseling is aimed at bringing about desired changes in the individual for self-realization and providing assistance to solve problems through an intimate personal relationship. Okay. Also, well, just to mention that counseling sessions are confidential, whereas guidance cannot be. It can be, but upon request, but usually they're not restricted to that. So counseling, like if counselee is a student, counseling helps him to take a decision, make a choice, or find a direction in matters related to an educational program or career. But it's not restricted only to that. We already understood that. It can be the situation, for example, let's say personal situation at home that they're facing. The first thing that you will notice is their disturbed behavior. Something will be off with them. So it's your job as a counselor to observe, to understand, and to approach the student first in order to identify how can you assist and what is going on. Okay, as I already mentioned, right now it involves something more than offering an assistance to find a solution to an immediate problems. It actually as well involves a series of meetings, but where you're using different tools and techniques, you're using a specific approach, you are recording every meeting, and you are actually also identifying whether it is efficient enough, intervention works or doesn't work, and you have to be ready to change the intervention method straight away. Counseling, as well as I already mentioned, it's centered around the need and aspiration of students. So here you can see types, areas of guidance services. Types of guidance services, it can be health guidance, it can be a vocational guidance, it can be personal, social, educational, and vocational. It depends in which field do you work, because uh, I think in every industry there are services which require counseling. So again, it depends on you, whichever you're providing right now. I am talking specifically with a focus on educational field right now. But again, the techniques and approaches can also can be used in any one of them. Mhm. So, organization of counseling services. Okay, here we can see that in educational institutions or colleges or schools, universities, um, eh, counseling services can be centralized. It's where we have a specific department with a specific trained personnel that is working towards providing counseling guidance services, and it's their responsibility to do so. Not, it's not the teacher's job, basically they're not intervening in that. But if it's decentralized, uh, such responsibility falls under teachers. Actually, they're the ones who are providing guidance and counseling sessions as well. So that's the reason I think in many schools you can see they're even hiring teachers with a specific background, not only in their specialization, for example, math teacher, but they're also looking for a person who went through specific training in counseling as well. It can be also a combination of centralized and decentralized counseling services as well, where it's a blended type of services where teachers and personnel, they're both providing upon request or upon availability. It depends. Sorry. Okay. So what are the purpose? We already talked about. Again, of the purpose of organization counseling services is to help individuals with their normal development, with their problems during crisis. For example, like right now during pandemic, it's very crucial and important. And we're here, we understand it as well. For example, also if you have observed any disturbed behavior at early stage, you're the one who has to manage it. I already spoke about the situation where there are critical cases. You have to approach specialists in that case. It's also important as counselors play a role of mediators between the institutions or colleges or schools and homes as well. Because right now, for example, what we are observing here is that, and we were all teenagers, so I think it's pretty understandable right now and obvious that students or teenagers, we do not really share all the things at home with our families. If something bothers us, if we're going through hardships or someone's bullying us, especially in school, so we are not the ones who go back home and straight away complain to our parents. So here is where the counselors, they take the role of mediators, where they identify the problem, they see the situation, and they inform the family. So also it's very important to have such kind of services embedded in at your office or whatever it is or whatever you're working, is because teachers are the ones who should actually receive the counseling sessions on the regular basis. Why? Um, Teachers are the ones who are dealing with children 24/7, and they have to be extremely skilled, extremely patient in order to be able to answer like 100 questions in 10 seconds, okay? And being able to control their emotions, their actions, their activities as well, their language as well. So it is really recommended to run such tests to check their mental well-being, and to guide them through as well if they're facing any, for example, family issues as well, because it will affect their work directly. So as we're speaking, the guidance and counseling services, they can be embedded in any department or in any type of the service. So for example, admission here, like partially, I'm also in admission team, and we have our admission team that is specifically trained to provide counseling and guidance. As I already spoke, when a person is perplexed and cannot choose between different programs, you're the one who is helping them to select the appropriate one. It can be also orientation service when the students are just enrolling, especially we're talking about international students who are coming from abroad here, they're homesick, they don't know anyone, they're scared, and you are the one who needs to make sure that they feel secure, they feel support, they feel there's someone there, be it a teacher, trainer, admission team, or manager, or whomever it may be, or even counselor himself. Information service, student information service as well. We provide general information regarding occupation, education, personal health, achievements, interests, personality, whatever it may be. The counseling service as well, it's already, we talked about it. It can be a separate service where they can understand, where they're directly working with students and with the employees as well. The placement service, the remedial service as well. You can see here, guys, the placement service, I think, oh, sorry. Sorry. Okay, here. The placement service, I think it's pretty clear, okay, that it's about the career expectations, where they should work, how to go through interviews, how to handle their CVs, what are the current trends in the market. It can be remedial service. It's trying to help them to go through emotional situations, their study habits, improve their performance as well. Follow-up service as well. We're talking about let's say how well the program works for them, how well college guidance program as well works, how efficient it is. We evaluate it, we research it as well. I'm so sorry, I'm going a bit faster right now. Why? Because I think we are on time. So the next is we can see the tools for counseling services. I already spoke about that. First, we'll talk about non-testing tools. So those can be first interviews. This is the most common, where two people are interacting face to face or online, virtually as well. It can be observation, where a person, even right now, when all the classes are held online, what we are doing is that one of our counselor is attending every class and observing the behavior of our students online, how they're doing so. So usually we are requesting and asking the students to keep video on, so we can see the response to the materials they're covering, to the trainer, the teacher, whatever it can be. It can be also anecdotal record. Anecdotal record, it is basically a snapshot of the main incidents that happen with individual. And also it can be cumulative record. It's the same as a snapshot, but it has more comments, more in-depth information, more meaningful and significant one. It can be also the checklist that we can use usually. So it is used to identify the presence or the absence of a specific trait in a student. It can be also rating scale, where we're rating from usually 1 to 10. As well, we're using it to assess the degree or the extent of the performance of a particular task or the possession of a particular traits in the student. We can also use sociometry. It's actually a very interesting test, sociometry as well, where it's a qualitative type of the research, where we're observing how well the person is perceived in the society, or by peers, or in the class, in a group of people, how he or she is behaving towards other people, and how other people are behaving towards him or her. Autobiography and diary, not very common, but sometimes it helps as well. So psychological tests, also we can use personality tests. I think we're all familiar with that. The Rorschach test, the Minnesota test as well. These are the most famous ones. But for example, Minnesota and Rorschach tests, they are very, very, like, let's say, very confusing. It cannot be used by just any person. It's used only by psychiatrists or psychologists, where they're using specifically to identify or to determine what mental emotional problems person is going through. So it's not very common test. Aptitude test as well. It can be specialized aptitude test, or it can be general one, just to determine the weakness and the strength, the main skills that a person possesses. It can be achievement test. Here we're working about very, very general, like admission test, for example, like in college or in university school as well. Interest inventory test, actually it's very interesting. Blank encoder preference inventory. I would suggest you to take a look at this one. It's actually a test where there are, I think, more than 360 questions, where they're identifying the specific interest of a person and whether he or she is eligible for some, like, let's say, to become a doctor or to become a counselor. Yeah. Study habit inventory test as well is the Brown-Holtzman survey of study habit. It's also very, very specialized one, where it's also used only by psychologists right now and psychiatrists, but right now they're using it in universities as well. It's actually aimed at identifying them, um, for example, what motivates students. It sounds so subjective actually, but that's the reason I'm telling you guys, check out this test. That's the reason I put them as an example here. Like how to determine what motivates a student, or why they have, for example, what attitude they might have towards the teacher or towards the education itself. So it's a very, very interesting test as well. um, Okay, so here the next we'll cover right now the main approaches of counseling. First, we're talking about directive counseling approach. It was advocated by Williamson. He is a professor at University of Minnesota. It is uh, the directive counseling is also called an authoritarian or psychoanalytic approach. So I think you will understand authoritarian. It means where the counselor takes the active role, where counselee is more passive. So it's more aggressive approach. Okay. The counselor helps individual in making decisions, finding solutions to their problem, of course, but counselor believes in the limited capacity of the patient actually, and that's the reason they're taking charge in the sessions, and they're the ones who are allowing the counselor to make a decision. But what they do whatever they can to get the patient make the decision that is in line with their diagnosis. Okay, and that's the reason counselor is literally trying to direct them in their thoughts, in their feelings, by explaining, interpreting and advising them. Whereas if we talk about non-directive counseling approach, it's absolutely opposite. It was advocated by Carp. It's actually called permissive counseling approach, where the counselor's role is passive and counselors is more active. So here, it is a more like patient-oriented approach, and it's more humanistic approach. The counselor makes, of course, the counselee makes the final decision in their problem, and if even if it doesn't go in line with their diagnosis, counselor has to accept the fact that a person can and has the right to make their own decision, and that's the reason they're accepting their capacity to make adjustments and to adapt. The principle of actually acceptance and tolerance are they're extremely important in this approach. And the third one, I think you already understood, elective counseling approach. It's a mixed one. It's blended. It's based on the fact that we are all different. We're not the same. We have different personalities, different lives, different backgrounds, different history, cultures, whatever it can be. So it is very important to observe, to identify what approach can be used. For example, today, if individual is in a bad mood and not talkative, so you're taking the active role. Tomorrow it can be vice versa. So that's the reason elective counseling approach is more widely used right now. So let's talk about the advantages of the directive counseling approach. Of course, it saves time. It directly focuses on the problem, nothing else. It allows the counselor to see the patient, or let's say the student or the individual, more objectively. It does not include much of the emotions rather than intellectual part of the individual, of individual's personality. And the approach itself, it's persuasive, it's direct, and I would call it's a bit passive aggressive a little bit. But what are the limitations are, of course, you can already understand without even reading all of this, that the patient or the counselee himself or herself, they do not learn how to take responsibility or liability for themselves. So they are not used to make their own decisions. So they literally just following the direction that is being set towards them without understanding why. That's the reason counselors, they become over dependent, and the last phase of, for example, finishing your sessions, they go through not very smoothly, and actually the whole counseling sessions can be useless if a person comes out of it without understanding himself or herself and what decision he or she has to make. Sometimes the counselee lacks information regarding the counselee, leads to wrong counseling. Why? Because it doesn't include a lot of subjective side in terms of emotions and feelings and thoughts. It does not include a lot of these data. It includes more intellectual ones. So that's the reason it can lead to wrong diagnosis. It does not guarantee that the counselor will be able to solve the same problems on his own in the future. With non-directive counseling approach, there are obvious advantages. Of course, it's slow, but the process makes sure that individual learns more about himself, actually discovers more, and they are not using a lot of tests that we just mentioned, for example, individual or aptitude test, because they feel like it overburdens the counselee. So they keep it very simple and light. And it removes emotional block that individual might have. So I don't think it's very easy, even if for us, for example, if we start talking to someone, it does like that we don't know, the stranger basically. It's not easy just to open up and start talking about our problems. So it removes this block, this wall between two individuals, and allows the person to actually reach their emotions and repressed thoughts and feelings on a conscious and subconscious level. So they're reducing tension, stress, and so on. But there, of course, it also has been criticized a lot because it's time consuming, and also because it's too subjective. You cannot rely on it 100%. And it's you're giving too much authority to the counselee. And what if the counselee, the individual, is not capable of making the right decision? What if he or she is immature or not wise enough, or lacks in some resources or skills to make the right decision, and you're actually accepting and allowing that to happen? So also, this approach, as I just said, is individual centric. It may not be possible for a counselor to attend every patient equally, and it requires high degree of motivation in the patient. And I just said why, because if, for example, one day you are not talkative, or let's say I'm introvert, I cannot really talk or maintain the speech or even initiate one. So how can a counselor use non-directive counseling approach, where he puts all the responsibility and liability on me to actually find out about myself, and he's the one just like a little bit like assisting me in that, but allowing me to do everything on my own. So electic counseling approach, it is more cost effective, it's practical, it's 100% flexible, it is more objective and coordinated approach of counseling. But as we can see, the role of counselor and the counselee are not predetermined. So in that case, it's not really clear what the structure of the session is, who is leading, who is not leading, who's active, who's passive right now. It requires an extremely skilled counselor to handle such kind of sessions using elective counseling approach. We can see there are other types of counseling as well. It can be based on the length. It can be based on the number of attendees. It can be in education, for education and professional purpose. It can be for health-related purpose, personal and social as well. So let's talk about the counseling process right now, since we are already running out of time. So the first phase is establishing relationships. So of course, it's very important to be able in the beginning to set the vibe of your actual sessions, of your therapies. And this is actually the most important part, the ice breaking session, where you have to make sure that the counselee feels trust, feels support and comfort in talking to you. So what strategies do we usually use? First, of course, we introduce ourselves. We have to possess adequate social skills. We always have to address individual by his or her name, just to make it more personal. So we're removing this blockage between us two. We ensure that he or she virtually or physically comfortable in the session. And we never ever interrupt a person when he or she speaks. Why? Because since the beginning, your task is to collect the data, the information that you will use in order to determine the diagnosis. Then you make analysis and to use specific approach or techniques in intervention. You have to listen attentively and observe also body language, how a person behaves, sits, and smiles even, or gesticulate. For example, personally, you can see I'm always gesticulating. That says something about my personality. So assessment, as I already told you, it's all about the data collection. You can personally ask the individual to provide information, the basic information about him or herself. It can be just about their life, general or physical data. They went through some, for example, traumas. It can be psychological as well, talking about traumas as well, about their life. It can be social environmental data. Where do they live right now? Who's surrounding them? Their achievements, their educational and vocational data as well. Where did they study before? What are their hobbies? Where do they currently working? And after collecting all this data is when you are the one who's analyzing and making the right decision, which approach and techniques you're going to use. And we already talked about the tools that you can use. It can be non-testing or testing tools. We talked about interviews, we talked about observation, aptitude tests, interest tests, autobiography. It can be used observation, interviews as well. I already mentioned that, anecdotal records as well, rating scales, whatever it can be. So here it's very important to identify you're using qualitative method or quantitative method, and from that you already you move forward, and then you choose. If it's qualitative, it can be more like interviews based, or um, it can be also questionnaires, it can be observation as well, or records. If it's more quantitative, we're using specific tests, aptitude, psychological, achievement tests, and so on. Setting goals, of course, it's important to make sure that the counselor, the individual, also knows what you're doing right now, and you mutually agree on the set goals. You have to consider his or her weaknesses, strength, their available resources as well. Um, what we can actually, what skills you have to possess in order to do so correctly. You have to think critically, you have to draw conclusion very fast and correct. You have to judge, you have to plan, you have to manage correctly, so possess relevant skills as well. You have to take the information and being able to work with that, segregate, differentiate the information that you just collected from your individual, from the student or counselee, whatever you call it, and you have to be able to analyze it properly in order to derive the conclusion where you just set the intervention plan. You have to be able to think critically, realistically, and help the counselee also set feasible, reliable, and achievable goals as well. The next phase is the longest one, is when the intervention comes along, where the phase actually is affected by the counselor's own thoughts about the counseling process, and it will also depend on the approach and techniques that you're using, and also the tools that you're using. And as I mentioned before, if we're talking about electic approach, it's when you have to be 200% flexible. If something doesn't work well, you have to be able to switch to the next tool or technique and use absolutely another approach. So the next is termination and follow up. As I mentioned before, if for example we're talking about directive approach, in that case, it doesn't termination doesn't happen very smoothly. But you have to make sure that you plan this ahead, and the counselee is informed about that and feels comfortable, totally comfortable about the departure. So the few follow-up sessions after that may be required to help them to adapt, to live without the sessions, to check whether they are solving their problems, they're handling their reality, their situation, their house or work situation properly as well, or independently. So here I just put qualities of a good counselor. You can see here it has he or she has to maintain confidentiality, observant, unbiased, non-judgmental, sensitive to the needs of the patient, empathetic. He has to or she listens carefully, lets the patient make decisions as well. He or she has to be open-minded, respect the rights of the patient, objectively answering the question, demonstrating professionalism at all the costs and all the times, obtaining appropriate information from the patient, and know that if there's a lack of information or there's abundance of information on in that case, you can actually conduct a proper analysis and diagnose right, and of course, good technical knowledge as well. So here you can see the components of preparation of counselor. I already mentioned that in the beginning. The proper educational background, master or bachelor degree in teaching education with training in behavioral science. We talk behavioral science in terms of psychology. Personal fitness and attributes should show positive interest in working with others, and just experience at least 2 years in counseling experience, or with the 3 to 6 months of supervised counseling experience as well. So I think that's, guys, the end of our webinar. I'm so sorry if I went too fast, but I wanted to keep like 10 extra minutes for the question or the interaction, or in case you want to turn on the video and say hi, that would be great as well. So please, anyone?
Thanks, Delena, for the wonderful presentation. It was very insightful. It's really nice to know about counseling, because I myself, being in the field of education, I have gone through this process, and I have dealt with students, especially who came to me, looking for advices and counseling notes. Now, just speaking from the educational perspective, I'm just giving an example. Anybody can, feel free to interact and, put your points across with the same. Mm, while I used to deal with my students face to face, there was a different kind of setting, a different kind of environment. We used to have a different sort of counseling room in and around us. But right now, due to COVID, as you see, the things have transformed virtually. Everything has gone online. So how do you feel like, from the perspective of counselors, in terms of, how easy or how tough it is for them to maintain the confidentiality, or, to support in the same manner as done in person. So here is a situation: in-person setting versus virtual setting. So what do you see today? And anybody can participate and give your insight on the same.
Actually, right now we are not seeing a lot of difference in that. Why? Because we are available 24/7, right? So, for example, even before COVID or pandemic happened, we would set, for example, the date and time. Also online, using, like, we all use social media, yeah, WhatsApp, emails as well, and text messages. So, and then the session would happen face to face. Right now, everything stays the same, but we're just using, for example, Zoom, yeah, to see each other. Of course, the interaction might be disturbed by different factors like internet connection, or someone is coming in, like entering the room or whatsoever. But apart from that, everything remains the same, and students, they also feel much supported, much connected to us. And we're also 24/7. We always remind to everyone that we're 24/7. We're available. Even yesterday, I was contacted by like 11 p.m., I think, at night. And that's the main purpose. I think virtual counseling is no different. It just takes different formats. We're just doing it in a different format, but everything stays the same. The human interaction stays the same.
Yes, thank you for the information. Other participants, we can have an ice-breaking session right now. Feel free to put your views across, and if anything that you would like to know, we are here to help you with.
Yes, I received some messages here, but if you want to ask um, the question, please, guys, ask any questions or just say hi. Thank you, Jennifer, as well. To you as well. Thanks, Shital Fernandez. Thank you very much. If, guys, there you don't have any questions, or if you don't want to, okay, wait a second. Thank you. I don't know your name, but iPhone. Yes, thank you very much. So basically, guys, if you have any question or whatsoever, you can always email me. You can also WhatsApp. Always available. I already said 24/7. Yep. So if there is no question, we can, I think, wrap it up. Thank you, Abdullah, as well. Yep. If you want, you can type the question, actually. It it can be related to actually anything, not only counseling. I think Can you share the documents so that I can refer it to later for more clarity if I have a doubt? Yes, of course, Grace. We will share as well. I think we will have available recorded session as well. The PPT also will be available, so we can email it to you. Thank you, Mona. It's very nice that you attended. So thank you, guys. I think we're all done. So I'll see you later if you will attend any next webinars that I will hold. And have a nice day. Stay safe. Wash your hands. Okay? Bye, guys.